Guys, I think there's also seats over here if anybody wants to grab a seat over here. If you're watching on Facebook, let me know if this thing is sideways or if it's right. Let me know if this is correct. Here we go. Why does this always happen? Alright, we're going to do it like that. Alright, guys. All right, we're going to get it started, guys, if I can get your attention. Guys, there's some seats up here yet. I know it's a packed house. Thank you for being here today. So the first thing I want to do is pass this sign-in sheet around. And if you don't mind giving us your name, phone number, email, that kind of thing, we'll try to get you on our newsletter list and keep you informed on what we have going on. If you guys want to move those chairs over so you can see the PowerPoint, that's fine too. We'll start this over here. So just to make sure that everyone is in the right room, this is Favor's Family Recovery Group. And the purpose of this group is to talk about different things related to dealing with a loved one who might be struggling with a substance use disorder. Whether that's whether it's super serious or you feel like you're not sure what's going on, or maybe your loved one's in recovery, who knows? There could be all kinds of different stages of this process. We feel like what we want to do is cast a wide net, give you as much information as possible as you deal with this. One of the most interesting parts of these conversations around recovery, and I don't know how many people have been to another family group or have sought counseling or therapy or anything like that. You get a lot of different opinions on this thing. You can talk to 10 different people and get 10 different opinions. And tonight, you're going to get my take on this, on these issues. Just to give you a real quick background on who I am and where my experience comes from and why I say what I say, this is just sort of who I am professionally. I have a master's degree in sociology with a concentration in addiction studies. I got an MBA. I have a lot of different credentials and licenses that allow me to practice. Licensed counselor, licensed clinical addiction specialist, that kind of stuff. So I have kind of like that academic background and that training background. But then the second thing people will say is, well, you don't know what you're talking about because you haven't been there, done that. Well, I've been there, done that too. I'm a person in long-term recovery. For me, it was alcohol. Alcohol was always present in my life. I took my first drink when I was 14. I didn't know anything about the brain disease. I didn't know how it affected my brain. I didn't understand that my brain was still growing. Nobody talked about it back then. You just sort of did your thing. But really what brought me to my knees was prescription pain pills. In 1999, I was in a car accident. I started getting these things hand over fist, and it took me to a real dark place real quick. I found recovery via an intervention, and then I did a lot of therapy. I did a lot of meetings. I changed my lifestyle. I changed who I hang out with, that kind of thing. Did a lot of prayer. My pathway to recovery, I guess you could say, is a pretty traditional, predictable pathway to recovery. I guess I did it in an old school way. Maybe that's the way to say it. I quickly got involved in professional work. Then I went back to school, became a therapist, and I started running programs and working in programs. And I had a lot of experiences along the way that have kind of widened my lens or changed my viewpoint on this issue. I used to be a guy that thought there was only one way to do this thing. It's either my way or the highway. You're either in or you're out. And if you don't do exactly what I say, well then get out. Go experience some more pain until you're ready to come back here and do it right. And then you'll hear terms like hit bottom. We got to wait for people to hit bottom. You'll hear terms like we got to wait till they experience enough pain, and then they'll come in and get it. My eyes have been opened related to that issue, related to two different areas. One was more and more young people coming in. We're talking to them like that made absolutely no sense. And I'm not the type of person who likes to talk to people and make no sense. That's just because somebody tells me it should be a certain way, I'm not going to say it if it doesn't make sense to me. And then the second thing was working with folks who have co-occurring mental health issues. As soon as you start digging into real deal co-occurring mental health issues, then you get into some more complicated territory. That was the experience that opened my eyes to maybe there are other ways to look at this. And then I really started to learn, and I started to dig into this process, which kind of brings me to the Favor Greenville family group. I'm going to talk tonight about a lot of different issues, but I'm going to talk a lot about this idea of tough love or detachment or how you should handle situations. And the reason is because I got a bunch of phone calls this past weekend about it. I got a phone call from a person from Arizona regarding this issue. They found me online, and he called, and he literally wanted to know if it was okay to talk to his son. He didn't want to know if it was okay to pay his son's rent. He didn't want to know if it was okay to pay his son's car payment. He literally had been told by a therapist that he should not even talk to his son. And so I want to get this information out there and tell you that if you run into people like that, you want to run the other way. I'm not talking about walk the other way. You want to run the other way. It's completely inappropriate advice. I don't even know where it comes from. I think it probably comes from this mentality that exists where we have to punish people and we have to pound them into the ground in order for them to want this recovery thing. I honestly don't know how to explain that. So that's the topic that I have in mind tonight. But I also like to throw things out to folks if they have anything going on and there's any topic that they want to talk about. Does anybody have anything that they definitely want to cover tonight? Or perhaps, it's related to this topic I was going to bring up. Anybody got anything going on that they want to make sure they bring up? Going once?
I have something.
Yes.
So it's kind of related to this issue, but for my son, I feel like he has, he doesn't really have, because of his substance abuse issues, he really doesn't have much of a life. He doesn't really have friends. So he has basically my husband and I, so I'm really trying to figure out how do I pull away from him enough to not really be...
It is exactly great. It's a great question.
Somebody fun to be around anymore.
Right. So her question is, how do I pull away enough in what is appropriate in that area? Mm-hmm. We're going to talk tonight about that very issue, because what we do believe in are healthy boundaries. And we do believe in allowing the person to experience life and find his way through life. We know that parents, and a lot of this doesn't necessarily apply to spouses, but parents, you will become overly involved, and that's a natural process. You want to protect your child, you want to help your child, but we believe there are ways to set boundaries, and that's what we would focus on related to this particular issue. Nothing about setting boundaries is easy, though. All of it is uncomfortable. It's very, very uncomfortable. Saying no is uncomfortable, that kind of thing. The world has gotten kind of strange where parents are concerned. I saw this on TV. I was reading this, and the headline was, it said, Utah passes free-range parenting law. Did anyone else see that? And it literally said, Utah passes free-range parenting law. And I was like, that's very odd. What is that all about? And I got on there, and it said, in Utah, they're considering legislation that would allow parents to have their children walk to school on their own, or sit in a car by themselves while the parent was in the grocery store. And I was like, when did that become illegal? Okay, like how did that happen? My parents, man, they would have been in jail. They were like, go figure it out, dude. Go figure it out. So there is this idea of, like, we are in a culture now, guys, where parents are overly involved. We got to call it like it is. We are in the era of helicopter parenting. Without question, it has nothing to do with addiction. Do you guys get that? That goes way beyond addiction. That's the case in all areas. I teach in high school. I teach college sociology in high school, okay? And when you teach in college, you don't talk to parents. Like, you simply don't talk to parents. Colleges have these built-in walls that keep the parents from being able to get access to you. When I taught at the high school, parents always wanted to know what was going on. Like, I literally had parents email me and say, and give me this explanation on why they didn't turn their term paper in. And how could they make it up? And I was completely freaking stunned, man. I got to be honest with you. I was like, and I literally emailed them back, and I talked to the guidance counselor. I was like, listen, I don't roll this way. I didn't sign up for this. I don't want to teach high school. I want to teach college. I'm not doing any of this other stuff. Any of this other care and feeding a parent type stuff that needs to go. It's a different world, and it's okay. We have to acknowledge it for what it is. It's different in all kinds of different ways. It's different in that level of involvement. It's also different in relation to technology. It's different in relation to the drugs that are being used. It's different in relation to the way that people can get drugs. When I was in high school, you couldn't go on the internet and have something delivered to your house. You know, things were pretty straightforward then. So we're going to talk a lot about this. I also want to make sure that what we talk about tonight, we try to apply it to spouse situations. It's mainly parents in this group, but a lot of the principles I talk about can be applied if you're dealing with a spousal situation as well. So we're going to definitely talk all about boundaries tonight. Did you have something you wanted?
You mentioned the co-occurring mental health and what we're talking about. There's always that issue with psychiatrists, you know, once you're not compliant, they want to throw you out of the practice. They don't want anything to do with you. But by definition, when you have mental illness and you're in the problem of substance abuse, by definition, you're not compliant. So how do we navigate that? Because that's a real issue with
Yeah, I don't know if you guys could hear the comment. The comment was addiction itself or substance use disorder itself makes you irrational. It makes you non-compliant. It comes with the territory, but you'll get kicked out of a lot of programs for being non-compliant. It is a head scratcher that the system has been set up that way. You know, basically, it's almost like you have to become like mini case managers, and you might have to use multiple facilities to get that done. I'm going to talk to you tonight about co-occurring disorders and how it works and different ways to think about it. But it is very, very hard when you get your loved one into services and they get kicked out for the symptoms of their disease. And it does happen more than you might believe. Do you guys know what I mean by that? When I say getting kicked out for the symptoms of your disease, the symptoms of your disease involve things like denial. It involves things like not showing up for appointments, that kind of thing. We're literally at a crossroads, guys. For the first time in the history of addiction treatment services, people are willing to look at it differently. It's been done the same way for about 40, 45 years. We're finally at a point in time, and it's not just Favor Greenville, but a lot of folks are saying that's not okay. What that thing that we've been doing where we kick people out for not following the rules, where we kick people out for not towing the line, that's not okay. The problem is there aren't a lot of providers. Just sheer numbers, there aren't a lot of psychiatrists, for example. They're hard to come by, they're hard to find. There aren't a bunch in South Carolina. The upstate we do okay, but if you move outside the upstate, you can't find a psychiatrist. So that's also part of the problem. It's kind of like you sort of got to play by their rules because you're not going to have any choice. So you also will get into this great debate on what is addiction. You know, what is it? I want to take all the debate off the table. You can call it a disease, or you can call it a disorder, or you can call it a syndrome, or you can call it a phenomenon. But can we all agree it's something other than bad behavior? That's all I want you to get out of this. That it's not, the person isn't waking up in the morning and trying to figure out how they're going to ruin your day. They're not waking up in the morning and saying, how can I go to jail today? They're not waking up in the morning saying, how can I, destroy my relationship today? That it's something other than bad behavior. And we've shown this many, many times. But there are some new folks in the room tonight. So this is a picture of the brain. And what you have going on my left, your right, is a PET scan. And what has happened is that's the depletion of dopamine. Dopamine is the neurotransmitter that is emitted when you feel anything pleasurable. It allows you to experience contentment. It allows you to experience a good day. it makes you feel like everything's going to be okay. And if all the dopamine in your brain is depleted, what will happen is you will resort to compulsive drug seeking, to compulsive alcohol seeking. You're going to find something that's going to make that better. Now, does anyone have any questions about that? Before I go on and on about that, does anybody have any questions about what happens in the brain? This is very important. If you guys are dealing with this is probably where it starts. You're probably wondering, like the way that I put it here, what's happening to my loved one? What is going on here? This is what's happening. The brain has changed. And this explains all the strange behaviors. What are the indicators that make that likely? The number one indicator is age of first use. How old are you when you start this thing? If you look at like treatment centers and you ask the question, how old were you when you first drank regularly, you'll hear 14. If you can push it, even if you can push it off till 18, you decrease the likelihood that you're going to develop this problem. I was 14 when I started with anything. So that's the number one indicator. The second thing is hereditary factors, genetic factors. It runs in the family. And then the third thing, environmental factors, psychological factors, and then also certain drugs are more addictive than other drugs. That's also a fact. So any questions about the brain or any comments about the brain? All right. We've gone through this too. This is just the criteria involved. If you were trying to figure out, is my loved one just having a good time, recreational use, experimentation, it's very, very subjective. Remember earlier when I said you talk to 10 different people, you'll get 10 different opinions? This is why, because it's not like taking an x-ray, right? There's no numbers involved. It's subjective. The person sits down with a counselor, sits down with a psychologist, and they talk to them about their history, and then this is what we have in terms of diagnosis. If you meet 6 out of that 11 criteria, a pattern, over the past year, you fall into what's called substance use disorder severe. And substance use disorder severe, that's essentially what we call addiction. Again, the person will tell you how they don't meet that criteria. You can easily explain that away. It's not like getting an x-ray. It's not like getting a blood test. It's my interpretation of the information you give me. Any questions about the criteria? All right. So let's talk about what it's like to go through this. Let's talk about what it's like to go through addiction, what it's like to be a family member dealing with this, and really why do people change? Why do people change any kind of behavior, but certainly where addiction is concerned, and certainly when your brain is looking like this, okay? When you cross that line and you don't have full brain function, or however you want to say it, why do people change? People typically don't change just because you tell them to change. People typically don't change because you punish them. People change, they go through a predictable process. And this is where we want to get in touch with this idea or this model that was set up around tough love. Okay? Around consequences and punishment will lead the person into recovery. It was never based on any kind of sound psychological principles, guys. It was basically a reasonable way for the families to be told to respond, and it fit in with the whole entire culture around addiction services. Because addiction services in general were punishing and confrontational. So we had to teach the family to be punishing and confrontational. And that's where the term tough love came from. And what we would say is that there might be another way to look at that. There may be a more realistic way to look at this. Do you have to sometimes set boundaries and ask somebody to leave your house? Yeah. You absolutely have to, right? Do you have to set boundaries and allow them to, get kicked out of their apartment because they're not paying the rent? Absolutely. But do you have to be tough about it? No. Like if you look at the definition of tough love, it literally says harsh or stern. Harsh or stern. Do you actually have to be harsh or stern? I would imagine there are some people out there who have antisocial personality disorder, and maybe you have to be harsh or stern with them. But other than that group, and that's probably a relatively small, relatively speaking, small group of people. That's not the majority of people in addiction, guys. That's a certain group of people. If they're wearing you out and you need to set those hardcore boundaries because they're wearing you out, do it for yourself. But please be clear, you don't have to do that because you're checking some kind of box and you're being a good parent by putting the hammer down, or you're being a good wife by putting the hammer down. That's just not how this works. That's not based in fact. That's 100% based in myth. I've heard people say crazy things to parents about this. I've shared this before. I witnessed firsthand. Now listen, I want to go on the record and tell you, like, I don't care if people who are in self-help groups are telling parents, tough love. They're just doing the best they can. But if you're a professional and you're supposed to be educated in this field and you're supposed to represent the highest ethical standards, to tell people, just kick them out, practice tough love, step back. I heard a guy say, don't even give them a bologna sandwich. I've shared that in here before. It's one of the stupidest things I've ever heard anybody say in my life. First of all, who the hell wants a bologna sandwich? Fried bologna sandwich. So, we want to challenge some of these myths, and we want to encourage you to kind of think it through. And one of the things I want you to do is I want you to stop being guilty. If you're being guilty, and if you have this thing in your mind where you're like, I'm the world's worst enabler, I'm the poster child for enabler, I'm the world's worst codependent, try to get that thinking out of the way. You're doing the best you can in any given moment with your child. You're doing the best you can given what you know and given what's going down. This isn't about, parenting in general is not a contest. Relationships aren't a contest. It isn't about right or wrong. You've done the best you can. You might want to learn different ways to respond to certain situations as you move forward. And then the other part of this, again, referencing the person who called me over the weekend and asked me some questions about maintaining contact. Maintaining contact with your loved one, especially if it's just around regular conversations, especially if you're talking about the weather, or you're talking about the March Madness tournament, or you're just talking about life, and you're not rescuing them, maintaining contact is actually a really good thing, guys. Detachment for the sake of detachment is not a healthy response for you or for your loved one. Why would you want to detach completely? You would detach completely because the person is physically abusive, verbally abusive, stealing your property, those type of things. If that's going on and you need to literally preserve yourself, then you have to detach. And the idea of detachment, guys, in the past, it didn't even have to do with physical detachment. It's been totally co-opted, and it's gotten really strange. Detachment was what was taught to wives in the 1960s and 1950s through Al-Anon so that they could continue to live with this son of a bitch. Because you couldn't get divorces back then, right? Well, can we agree to that? Sociologically speaking, the culture at the time was we don't divorce. So if I'm going to live with this guy, I got to figure out some way to deal with his shenanigans. He's getting hammered every night. So what do? I emotionally pull back and I emotionally detach. Does that make sense? And you can see in that context, detachment makes all kinds of sense. But detachment has been turned into don't talk to him, don't have anything to do with it, don't even give him a bologna sandwich. So that's what we want to challenge. That's what we want to help people get through. You also have to be careful with this myth or this idea of hitting rock bottom. In today's world, too many people are dying on the way to rock bottom. If you want to think of some ways to approach the whole rock bottom idea or that part of the process, maybe one of the ways to think of it is this kind of phrase, I will support you in your recovery, but I will not support you in your addiction. So I'm not just going to sit here and I'm not just going to wait until you fall on your face. I'm not just going to sit here, I'm not going to wait until everything gets so bad that you come crawling back to me. I'm going to maintain contact and I'm going to continuously be checking in. Do you want any help? Do you need any help? Do you want any help? Do you need any help? That kind of stuff, where you would be ready to kind of help guide them in to the best of your ability into some type of program or some type of support if they wanted it. Does that make sense? That's much different than waiting for a person to hit rock bottom. Waiting for a person to hit rock bottom would be, I pull back, I'm over here, call me when you need me. The other option would be trying to reach out. Again, guys, I'm saying this, I don't know everyone's situation individually. If you're in a situation where you literally can't have contact with your loved one, where maybe you don't know where they are, or talking to them is so emotionally distressful, then maybe you do want to set that boundary. let's stop here for a minute and make sure that we give you a chance to ask questions. Did you guys get what I'm talking about with that? You have to apply what I'm saying to your individual situation. Yes, sir.
I think I spoke to you about 6 months ago, but my son and I were at least emailing for a while, and then I made the horrendous thought of saying that I realized now drug abuse was not a character flaw. And he went berserk saying, I even thought that, and it was, don't ever speak to me again. And
because he interpreted what you said as...
And about 4 months later, I won't go into reasons, but I did send him a simple card. It said, thinking about you, hoping for the best, they live out of state. And according to my older son, who does occasionally get some messages, he went berserk over that. So he doesn't want to talk.
So that's a perfect example of what I'm talking about. If the person is aggressive or going off when you try to reach out, that's obviously not going to work, right? It's completely not going to work. I would still make an argument though that you're reaching out. There's what is going on with him that he would react that way? Because when you touch base with him, what it does is it makes all his own issues kind of come to the forefront. That's what I believe happens a lot of times when people who are acting like they don't want to talk. If you send a text, you send a card, what it does is it makes them actually take a look at the stuff that's going on. When we're in active addiction, we want to stay on autopilot. We don't want to be thinking about those issues. But I get where you're coming from, and I don't know if everyone could hear what he was saying, but when he reaches out to his son gets verbally aggressive. And if that's the case, then you're setting boundaries for a different reason at that point. You're setting boundaries to preserve your own stress level. You're not setting boundaries because you think it's going to get him into recovery sooner. What other comments about these ideas of these myths that exist? Yes, ma'am.
I have heard tough love taught in a different manner. That you set the boundaries, you do what you have to do, but you do it lovingly.
Yeah,
That's
so
where the love comes in. It's
Yep.
tough to do this, to tell your child that no, you can't stay in the home and carry on this type of behavior.
Yeah, and I think
that's tough, but you do it lovingly instead of harsh. I haven't heard the harsh part.
Yeah, the harsh is like the quote unquote definition of it. That's literally the definition of tough love. It has the terms harsh, discipline, that kind of thing. Now, what you're saying is maybe the appropriate interpretation of tough love. What I'm telling you is the actual reality-based interpretation has been this punishing. Maybe the better thing is it's just love. If you actually think about this, and we've talked about this before here, why do we have to have the word tough attached to it at all? It's just the appropriate expression of love. Because love involves saying no. If you've ever had young children, you know that. I talk about this all the time. If I go home and my 5-year-old wants to drive my car, the loving thing to do is to say no to that. And it's exactly what you said. It's to say no in a way where it doesn't have to be harsh. It doesn't have to be punishing. You just say no. Maybe the term tough love came up as a way of trying to get people to feel like, because if you think about setting these boundaries, it does take some effort, right? I have to toughen up a little bit.
As opposed to, well, you just love them. You just love them. And I've heard people say that. You just love them and let them, and actually enable them as well.
So what I'm saying is there's something in between.
Right.
There's something in between. I don't know if you guys could hear a comment, but you can't go to the other extreme either. The other extreme where everything's okay and let me just love you to death and that kind of thing, or let me just keep loving you. That part of the pendulum's over here. The other part where is harsh, punishing. You're trying to find something in the middle, and it's not necessarily the message. It's how you deliver the message. It's how you go about it. That kind of thing. Now, I do think it gets really, really weird though when people in professional positions are giving people official advice about don't even talk to the person. Because I'll be honest with you, unless they're physically abusive to you, I can't think of too many situations where you couldn't return a text message or you couldn't reach out occasionally, unless they are abusive to you, that kind of thing. Any other thoughts, questions, or comments about this part of the presentation? Yes, ma'am.
I think I've heard you say a number of times how no one ever went to recovery. happy to go. And I thought that how most of us know how manipulative an addict is. So I feel like by allowing the natural consequences with our son, we kind of turned it around, and we were the manipulative ones, and I think that was okay.
No, it is okay. It's not manipulative either. So.
Because he wouldn't go to recovery,
Yeah.
except that he was arrested for probation violation because he was on drugs and couldn't pass a drug test. So we put our foot down for the first time and would not bond him out. So he spent 8 weeks in the Greenville Detention Center, and we ended up getting in front of his probation officer and came up with a plan that she put before the judge that part of we wouldn't bond him out. Could have the first day. It wasn't about the money, but we wanted him to have the time to become sober, be able to think. Hopefully the brain, the dopamine levels are back up now, but with working with the system and probation, she went and had the judge, he had to finally agree.
So what I want to tell you though is if you follow like the strict model would have been for you to stay out of that completely. Listen, guys, do you guys hear this example? Because she did the right thing by getting involved and kind of, in your words, manipulating the situation.
Your staff helped us begin.
I'm glad you did what you did.
But if he had gone to Mars Village because we bonded him out, he still could have walked away. Mm-hmm. When I got probation involved, probation had him sign and agree that he would go to Mars Village, and if he walked away, he's in violation of probation, and it'll take him back
So
to jail.
let me talk about that for a minute. Let me talk about that for a minute. So I don't know if everyone could hear what she's saying, but the situation is the kid's in jail, and they let him sit, okay? And through that process, you're setting boundaries right away. So you're actually it's not about whether you're tough or not. You're doing the right thing. You're setting boundaries. But from a strict standpoint, a lot of people would tell you not to even stay involved, to step back. Do you guys follow this? And separate. I have a graphic that's going to talk about that. And you actually did exactly what we would want you to do. We want you to stay involved. We want the parents to stay involved as much as they possibly can, because look at how that went down. That was technically the only way that was going to go down was if you guys were steering the controllers a little bit. That kid would not have wound up at Morris Village if the normal course of action would have occurred. He just wouldn't have. So, and we talk in here all the time about trying to empower the family, and I don't know if I would use the word that you were manipulative. I don't think you were manipulative at all. I think you were doing the right thing. You were setting healthy boundaries. You were trying to use the system to get your kid help. And guys, sometimes the legal system is the most effective part of this equation, and we've talked about that in here and how uncomfortable that is, and I'm not acting like that's an easy thing to allow your child to experience legal consequences, but sometimes the legal system can step in where parents can't. Kids don't have the luxury of ignoring the judge. They got the luxury of ignoring parents. So I would say what you did, you handled that very, very well. And I'm glad to hear that somebody from here was kind of helping you with that. Do you guys get that? That is definitely not, that's just the appropriate expression of love. That's doing everything you can to kind of guide your loved one into a recovery program. What other comments about these myths or these ideas? All right, so we've talked about this. There's a process that people go through. It's a natural process of change. It happens for any behavior change. If you study people and you hear their story, you'll find out they took a journey. Recovery is a journey. It's very rarely an event. Very few people wake up on a Wednesday morning and say, "It is a beautiful day today, I'm going to rehab. My life has been going great. I didn't really think I had a problem on Tuesday when I went to bed, but it's Wednesday. You know what? What the heck? I want it. I want recovery. Let me go get it." Very, very few people, it goes down like that. They tend to go through a series of psychological ruminations and exploring this issue in their own head. They tend to have some consequences that come along. And as they experience these things, they wander their way into recovery. And many people wander their way in and wander their way out and wander their way in and wander their way out. And those of us who finally find it, 17 years later, we need to get up in front of people and tell you exactly how messy it was. Because it wasn't smooth. It wasn't smooth. It wasn't like, boom, this linear process. People tend to find recovery, and then they tend to act like they got it the first time, and they've always had their, I won't say the word, they've always had their act together. Let's just say it that way. And, I'm Captain Recovery, man. I got this thing. You just did it the way. That's not how, it's messy. It's one step forward, two steps back. And you go through this process of recognizing it's a problem. That's the contemplation area. Pre-contemplation is what we used to call denial. Back in the day, you hear the word denial. Psychologists, they can't handle simple words. So they had to come up with pre-contemplation. You don't even know it's there. It's not a big deal. Contemplation is where most of the folks are whenever we meet them. They know something's up. It's clear that this is a problem of some level, but I'm not quite ready to do anything about it. Preparation is that stage where people start to make plans for change. Maybe they find out where there's some 12-step meetings. Maybe they start calling rehabs, but they start to do something about it. They start to plan to do something about it. Action is, I'm doing it, and maintenance is, I've been doing it. It's a routine now. And if you look at this circle right here, anybody can have a lapse or a slip or a relapse at any point in terms of change. How many people in here have tried to change anything in their life? Their diet, exercise, smoking. How many people have got it perfectly right the first time? You guys can leave. What tends to happen now the problem is where substances are concerned, there's such a heavy consequence associated with them, right? That's really what this is. This is different than trying to get into a routine of eating differently. There's heavy-duty consequences. That's why everybody wants it to happen, and I get that. That's why it's so darn serious, and we need to take it serious. But we really need to understand the natural process of behavior change. Any questions about these stages or comments? All right. Now, how do you help a person through that process? How do you help move a person along? We teach all our staff here, and we embrace this, and we live through this, and we actually believe in this idea of motivational interviewing. It's meeting a person where they're at. I'm not going to give anybody a speech when they come into favor. I'm not going to wave my finger at them and tell them you have to do it this way or you have to do it that way. We've been criticized for that. We're kind of... people will totally misunderstand this. They'll think that we're okaying bad behavior. It has nothing to do with okaying bad behavior or okaying drug use or anything. It just simply has to do with one fact. Human beings do not like to be told what to do. They don't like to be told what to do. And if you're going to resort to the lazy approach, which is just telling people what to do, the only thing you have left is waiting for them to hit bottom. Does that make sense? If all I'm going to do is tell Frank, you got to do it my way, and Frank says, screw you, I'm not ready to do it your way, my only response to him is, well, then go figure it out, dude. Go do it your way. Come back when you're ready to do it my way. We don't want to do that. And we also believe that as spouses and parents, you can also fall into this trap. You can also fall into this trap. And I'm by no means am I saying you need to be a counselor with your child, but sometimes you have to be strategic on how you have these conversations. Like, I don't use motivational interviewing with my kids at home necessarily. I'm not like, tell me how you feel about taking the trash out. What are your thoughts on whether you should do that or not? I don't necessarily do that, but I do think with my older kids, I'm strategic about when I have the conversation and how I have that conversation. And I know what it feels like when I blast somebody out of the water and it doesn't go well. I don't know if anybody here has had that experience. Again, if you haven't, you might want to go. Everybody here has had that experience. Why sometimes do we wind up blasting somebody out of the water? What happens? Who said that? Who said we're mad? Yeah, so emotions get involved. You start talking impulsively. Maybe you say things, sooner than you should have. Maybe you should have sat on it a minute. You get emotional because there's reasons to get emotional. These are very, very serious issues. So you just go right to it. I've had this experience I've shared with this group in here before, how I tend to roll with my older kids. Man, when I go off, I go off. And I say outrageous things that there is absolutely no truth to the threats I'm making. I know every cop in Greenville County. I'm coming down there, they're coming down there, and they're busting that house party at Clemson. Okay, Yeah, Rich. That's going to happen, man. That's really, and so, but why do I do that? Fear, anger, frustration. What do you think my daughter does when I break that speech off? What do you think her psychological response to that is?
Not listening.
She shuts down. Like in her case, she doesn't even argue back. Have you ever had this experience with anybody? I don't think this is only unique to children. This could be a spouse too. Have you ever been talking to somebody and you know while you're talking to them, even if they're not arguing, that they're not listening to anything you're saying? They have literally shut you out. They've literally shut you out. You're starting in on them, and you are giving them the best advice that they've ever had. You're giving them the best advice, and if they just followed it, their life will change forever. Don't you understand, Ginger, that this is what you need to do, and you need to get a sponsor, and you need to go to meetings, and you need to change the people that you're hanging out with, and you need to get back in school, and you need to get a job. And they stopped listening basically as soon as I said Ginger. And nothing else got in. And I think that's the way the world works.
But isn't most of that true? I mean, maybe you can't say it that way, but isn't most of what you just iterated pretty true?
Yes, it's also true that I should change the way I eat. It's also true that I should not text and drive. It's also true that I should drive 60. I mean, there's a lot of things. Absolutely, it's true. Absolutely. But it's not about what you're doing is you're trying to move the needle on recovery. Somebody said something about being manipulative. I won't use the word manipulative, but you're trying to be strategic about and I know it sounds weird, guys, because it kind of sounds like I'm talking about like how to conduct your business. This is what you would do with an employee, for example. Let me try to move them along. But you got to think strategic, and you got to be saying what's going to make it sink in. What's going to make it sink in? And here's the other thing. Trade on your own experiences in those areas. Ask yourself what works for you. What motivates you? Who do you listen to? Do a quick exercise. Just take a second right here, right now. And I don't want this to be a family member. I do not want this to be a family member. I want it to be, it could be a school teacher, it could be a football coach, it could be somebody from the Army, it could be anybody like that. But I want you to think of a person who helped you, who was very important in your life, other than a family member. Take a minute and think of that person. And when you have them in your mind, I want you to just think, and if you want, you can share it out loud, but what were the characteristics of that person that stands out? Yes?
Non-judgmental.
Non-judgmental. What else? Supportive. Good listener. I haven't heard anybody say he knew everything in the world. I haven't heard anybody say he was a badass hard ass. Okay? I haven't heard anybody say he was mean as a snake. I haven't heard anybody say he read me the riot act. Do you follow me? The people that are important to me, my high school football coach, this is what I could say about him. I knew he cared. And how did I know he cared? Because I felt like he listened. Do you guys hear me? I knew he cared because I felt like he listened. Now, where families are concerned, this gets hard because there's a lot of water under the bridge, right? There's a lot of emotions. I've shared in here about how I butcher family situations regularly. It's like one of my favorite pastimes. But but if you can step back and you can try to use some of those principles, again, very difficult, but listen more than you talk. Whenever you're in a situation you're angry at somebody, you tend to talk a lot. Listen more than you talk. Ask open-ended questions. Gather information. Don't go into the situation with both guns blazing. Unless going into the situation with both guns blazing works. If you've had that experience where, and I'm probably making an assumption, but if you're here, that probably hasn't worked. Because you probably have already employed that strategy. Most people in this room have probably told their loved one they're tired of their shit. Excuse my language, right? You've said that. You're tired, I'm tired of this stuff. I'm tired of this. You probably have said that already. And you probably have said it in, how do I want to say this? In a relatively vehement manner. They're probably aware where you stand. So you're trying different things. You're trying different approaches. One of the other things that happens that's very, very interesting, if you talk to people who are used to combative situation and conflict-filled situations, and addiction is just full of chaos. If you're used to that and all of a sudden the other party changes their strategy, and stops arguing with you. I think I talked about this 2 weeks ago, or maybe last week. We talked about this. If I'm used to my wife arguing with me all the time and telling me how wrong I am and telling me how, I can't believe you did this, even though she's right, even though she's absolutely right, I'm used to that. I fall into my role of arguing. Now all of a sudden, what if she changes that? What if she's not? I remember when I wrecked the car on New Year's Eve and I couldn't get her to argue about it. I literally started arguing with myself. I had to fill the silence that was there. All right. Let's talk about co-occurring disorders real quick, because it came up earlier. Co-occurring disorders. One mental health issue, one substance use issue. What are some of the most common? Anybody have any guesses on some of the most common that we see at Faber Greenville? Anybody want to throw it out there what they think it is?
Depression.
Yeah, depression or anxiety and drug use, but
Yeah.
there's also different drug use, right?
Absolutely. Depression and anxiety on the mental health end is the most common thing that we see here. And I can't tell you what those percentages are, but without question, we'll see a lot of folks who come in and they have a diagnosis, usually from a psychiatrist, that kind of thing, of some type of anxiety and depression. A lot of times they're on medication for that particular issue, that kind of thing. And one of the things that's going on a lot is there's this question, and it comes up a lot for the individual person, but it also comes up with the family members of kind of which came first, the chicken or the egg? Like, what's really driving the ship here? Is my son using marijuana or using alcohol or using pills because he's so depressed, or is he so depressed because he's using pills? Those are the questions that come up quite a bit. And what I can tell you is there's no definitive answer to that. I'm going to talk to you a little bit about different ways to think about it, but nobody has that figured out for sure. I can tell you that these things go hand in hand. You'll see a lot of it. Some studies suggest that about 60% of people with a substance use disorder also have a diagnosed mental health issue, that kind of thing. So folks like me, I came in, I didn't have that. I guess I would have been a simpler situation. I say this all the time, like I'm very non-judgmental about people finding recovery, because recovery was set up for me. Everything about it, I had access to it. I had the money I could afford to get treatment. I had a car that I could get to meetings. I was literally at the perfect age to get recovery, like 32 years old. Most of the folks that I went in, I could relate to, that kind of thing. I found a group that was other professionals. It was like tailor-made for me, right? I didn't have a co-occurring mental health issue. I have great compassion for people who have this going on, because it's a harder mountain to climb. It's a harder mountain to climb. But if you look at this is one way to think about it. All of these issues aren't the same. So over here you have low mental health and low substance use. That would be somebody who's smoking marijuana every once in a while and reports like generalized anxiety. Neither one of them are destroying their lives. Do you follow that? That person needs counseling and needs support, but probably doesn't need to go to rehab, may not need to go to meetings. He needs low-level intervention. Does that make sense? This category right here, low mental health and high substance use. This is probably the category that Faber Greenville sees more of than anything. This is a person who maybe has like low-level anxiety, but serious opioid use disorder. Low-level anxiety, serious alcohol use disorder. Now this person, and I'm saying this because you guys have to, like, you're going to be in situations, you're going to be saying what type of program. They need to be in a primary, because you're going to find very few programs that do both of these things. Unfortunately, you're going to have to pick one or the other. This guy needs to land in a drug and alcohol program. Does that make sense? Because this is the high part of it. Is this clicking? Then the other option is low substance use, high mental health. Let's say, so there is like very severe major depression. It exists. It exists without substances. There are people out there, I don't know if you know it or not, but suicide is the second leading cause of death among people under the age of 50. The first is overdose. So major depression is a real deal. This person would need to, if you had to choose, where would he land? You want him to land in a mental health facility or mental health. Now, under best of circumstances, you're doing both. But I'm just saying if you feel like it's one or the other. And then this situation, this is tough. we do have this here, but this would be a person who has major depression and a very serious opioid use disorder, that kind of thing. This needs specialized care. What we would do with that person is we would try to do both at once. Both at once. Get you in to see a psychiatrist, get you in to see a mental health therapist, and have you come to Favor every day of the week. That would be the type of program that could help that person. How would people figure this out? Hopefully they would have an opportunity to figure this out with their psychiatrist, depending on how much time you get. You guys said it, not me. Depending on what that looks like, that kind of thing. But does this guideline make sense? Does anyone have any questions about a situation they're dealing with that they may want to explore a little bit on how to approach related to COD? All right. So how does it go down? How do we look at it? I think I said this already. The first way to look at it is the substance use disorder causes the mental health issue, right? You guys like that little graphic? Look at that. I'm getting good. Boom. Substance use causes mental health. So this would be the theory where I've been drinking so much and my life has gotten so out of control that I'm depressed over it. And I'm having suicidal thinking, and I can't get out of bed, that kind of thing. You know, that's one way of looking at the issue. A second way of looking at the issue is the mental health causes the substance use. So I've been so depressed my whole life that the only thing that makes me feel better is cocaine. And when I use cocaine, that's the only way I can get out of bed. That would be this example. Probably a better, healthier way to look at it is you're not going to probably figure out which came first. It's just you know that each one feeds off the other. It's going to be very hard to tell which came first. I've had some situations where it's very clear that the mental health came first because the person talks about their history. They picked up a little bit later in life. So let's just say, for example, the person didn't start drinking until they were 18, but they can report depressive symptoms the whole way back till 16. That would be an example where you probably have this going on. That kind of thing. How it used to work is, it was very extreme. What we would say, if this was the case, what we would tell people, and I would never tell people this because I worked in a dual diagnosis program, but what would typically be told to people was, stop drinking, the depression will get better. Stop drinking, we'll reevaluate this in 8 or 9 months, the depression will get better. If we took this position, what we would say is treat the depression, take your medication, come see your therapist. You know, your drinking's probably going to go away naturally. Do you guys see how we don't really want to approach them from that angle? So if you're dealing with somebody who's saying, you know, I'm anxious, I'm depressed and stuff like that, you can get them evaluated by a psychiatrist, but they shouldn't abandon their recovery program. It's probably not going to get fixed. This is probably not going to happen. If you guys are sitting in here, there's probably something serious enough going on with your loved one where they're not all of a sudden going to get their mental health fixed and the symptoms are going to go away. Does that make sense? So what we would promote is both. What would be an example of both? We would promote addressing both. An example of both would be going to AA meetings and going and seeing a mental health therapist as well, and a psychiatrist. Going to Favor meetings and also seeing a mental health therapist. Going to an inpatient program that actually does dual diagnosis. Now you got to be careful because everybody says they do dual diagnosis. There's some good programs around that really do. They get a full-time psychiatrist on staff. They see the folks when they come in. There are some really good programs that do that. But there are a lot of programs that say they do that. And what they mean when they say they do that is they have a psychiatrist signing off on paperwork, and this psychiatrist really never sees the patients. You got to be real careful when you're shopping around for programs, guys. Does everyone know that? Just be careful. And when you and don't ever dial that 1-800 number, that dude you see on TV. You guys know who I'm talking about? The guy who's dressed up as a doctor. You're just calling some number, and they're going to sell your lead to the highest bidder based on what insurance you have. And then the next thing you know, they're going to be sending you a plane ticket over to GSP, and you're going to be putting your loved one on a plane to California. And he may wind up in an okay program. He may wind up in hell. I'm not kidding when I say that. Get involved in selecting the programs. Let us help you get involved in that. Any questions about the co-occurring disorder stuff. Anybody have any questions or comments?
I have a question.
Yes.
If the person has self-medicated for 5 to 8 years, and then that's out of their system because of incarceration, and I would expect depression because of circumstances and now
Yes.
withdrawals. So for how long do you try not to, well, Lutrin, he was given in the detention center
Yeah.
to help. And, it was even suggested maybe he was bipolar. And I'm thinking, well, how the hell do you know? You haven't been off drugs for 8 years.
It's
So
very
you don't
tough.
know.
It's very, very difficult to know. That again, our default advice would be to try to get that person involved in both services. Now, it's not going to help happen in jail, but it would be in dual services, both recovery services and mental health services. That would be our recommendation. And then everything associated with that is all the stuff that goes down with the system, right? You have to find somebody who's going to do a good job with that. You have to find a psychiatrist who's going to do a thorough exam and have a real opinion on, is this bipolar type 1? Or are you diagnosing that in 7.5 minutes at the jail? Which is very difficult. I mean, can you imagine trying to figure out what's going on there? That's not going to happen. So, but what we want to be careful of is this idea of let's ignore. The best example I can give you is around the alcohol end, only because this was so common. It was such common practice. Just stop drinking. Don't do anything about the mental health. Just ride it out. It'll get better. And if it doesn't get better in a year, then we'll get you looked at. I would encourage you not to take that approach. I would encourage you not to take that approach. Does that make sense to everyone in here? If at all possible, don't take that approach. And now, I understand that there will be people who respond to that. There will be people who it really was just alcohol use disorder, and once they stopped drinking, their life improved and the depression went away. I think to a certain extent that happened to me. You could make an argument that I was depressed in early recovery. I mean, let me tell you something. I wasn't happy. I can tell you that right now. But you can't take my personal experience and apply it to everybody. You really have to get this looked at by a medical professional. That's my take on it. Cynthia?
I hate to bring up a political topic, but I think it's...
But you're going to anyway. Anytime, a couple things real quick. Anytime anybody says, I hate to bring up a political topic, they're going to.
Is there going to be some degree of accountability with what the federal government has just passed as far as treatment and recovery?
So, Cynthia's talking about a bill that just went through that allocates $7.4 billion for prevention, treatment. Also, a lot of that money is going to criminal justice, that kind of thing. And we were told when I went to Washington, part of the deal was, and it wasn't because I went to Washington, there were a lot of people doing this, that $220 million had been set aside for recovery support services. That number, when the bill went through, changed to $7 million. Okay, that's a pretty freaking big difference, right? $7 million won't even take care of the upstate of South Carolina. $7 million, if isn't really going to get it done even here in Greenville, to be honest with you. I don't think there'll really be any accountability because essentially that money is going to treatment, quote unquote. So it's going to be hard to make an argument that you didn't do anything. It's just, in our strong opinion, you're missing the boat when you keep pouring the money into the same thing over and over and over again. I believe that's kind of analogous to putting gasoline in a broken down car over and over. And we're over here with a different car, right? We're over here with another car. Our car's a hybrid. We only need half as much gasoline. Actually, we only need a quarter as much gasoline. Give us some gasoline and let us see if we can give some people a ride. That's a pretty good analogy I just made.
But I'm just wondering, is success rate going to be measured into those formulas? I mean, you can have all the treatment, recovery, and everything in the world. It's just like educational institutions. You can have all the educational and the paperwork, but how will we know?
Yeah, it's a great question. How will we know whether or not it works? The most honest answer anybody could tell you is that they don't measure it right now. There are things that they'll measure, like total number of people through, things like program completion, but they're trying to measure things, and there are some studies out there, but nobody's really done a good job. All the studies are criticized because a lot of them are based on self-report. So they'll say, like, how do you know the person actually didn't use? Well, we called them when we did a survey. I think it's really hard to do outcomes in the drug and alcohol world. I think it's a very difficult thing. I don't judge them given the fact that they haven't figured that out yet. But they haven't figured it out yet. And the money is just going into the same thing. And I'll tell you what outcome I can measure. 65,000 people dead. And every single year it goes up. So if I was in charge, I'd say, you're not getting any more money until death rates go down. Well, we don't know what to do. Figure out a way to keep people from dying.
Well, if the
Come
crime
here.
rate goes up, that's an indicator.
That would be an indicator of failure, in my opinion. It would be like if more kids flunk out of school, clearly the school's not doing their job. If more people die of substance use issues, then the substance use disorder treatment industry is not doing its job. But I'm not in charge. So, all right. So that's what's happening to your loved one. What's happening to you? Let's talk.
One
Yes.
quick question. Can our favorite coach, provide us with recommendations for these co-occurring, what you call the dual diagnosis programs?
Yes.
Coach can help us with that?
Yes, absolutely. And even I think if you look at our website, I'm not sure if it's broken down by co-occurring programs, but there might even be on our website information on that. So the coaches, Carol's a coach. I don't know if there's any other coaches in here. Hubert was here a second ago. Tack is here. They've been meeting, and they've really, and I get on them about this because I'm not a big meeting, let's talk about resource guy. But they've been meeting and really picking each other's brain around resources. So your coach should be able to help you in that regard. All right. Now let's talk about what's going on with you as a parent or a spouse dealing with this issue. So now we talked about what's happening with your loved one. What's going on with you? And a lot of this we talked about, but I wanted to talk about this thing called anticipatory grief. We had a person visiting us 2 weeks ago. He's a mentor of mine, a person that I used to work for at the University of Pittsburgh Medical Center. And he writes about this thing called anticipatory grief. And it's a very, very difficult process because it's when you're dealing with any disease where death is a possible outcome. And how you spend a lot of time, it's even more than worried about that, almost waiting for that to happen. It's a phenomenon that's been studied related to cancer, for example. It's never really been applied to the addiction world, but I can't imagine it's not applicable to what you guys are dealing with. That you have all this garbage around the issue, all the crap that goes along with it, and then in addition to that, you have this thing in the back of your mind, which is the worst, possible result. And now, why am I talking about this? I'm talking about this because you need to stare this in the face, guys. You need to understand that it's there, and it's normal, and it's okay. And if you acknowledge it and you start talking about it, we start talking about it in this group, you're going to start to feel better about the situation. This is one of the hardest things that you guys are going through because of the heavy-duty nature of this. And the other part of the problem is the stigma. You're probably not getting as much support for this issue as you would if it was cancer or if it was heart disease. If it was cancer, somebody would bring a casserole over to your house and sit with you and talk, right? And give you support and pat you and say it's okay. With addiction, what do people do? They stay away from you because they're afraid we want to make sure my kid might catch it. Make sure I don't want to catch that addiction thing you got over there, Rich. I'm going to go over and lick their face. Be like, you got it now. What do you think, Jen? Be like, you got it now. You just got addiction. You better go to rehab. It's like freaking Ebola. So it's really, really hard and to understand some of the stuff that goes along with that you really got to be careful of whenever you're dealing with anticipatory grief in other areas. A lot of times it'll come up in isolation. One of the main things that happens when people are dealing with anticipatory grief is they isolate themselves from the world. And I don't know if you guys have gone through that in here where you felt like you didn't want to go anywhere. You just don't really want to see anybody. You don't want to run into anybody at the grocery store. Have a talk about how your kid's doing, how's everybody. You don't want any of that crap, right? You got to be careful, and you sort of want to try to fight against that. That instinct to isolate yourself. You sort of want to fight against that. The other thing I want to talk about is there's also grief. In terms, there's grief, there's anticipatory grief on what could happen. There's also grieving a lost dream. Or a life that you thought was going to be a certain way. For parents, it's all those things you thought that was going to happen for your kid, right? All the stuff. Graduation from high school, graduation from college, getting married, we're going to have grandkids. All that white picket fence stuff that we want for our kids. You're going to go through a grieving process related to that. For spouses, you're going to go through a grieving process around this ideally kind of like, sort of like dream that we had about how we were going to live this out and what it was going to look like. And now all of a sudden I'm married to a madman. You have to go through that. And how do you face this? First of all, you acknowledge it as normal. You acknowledge it for what it is. You reframe it in your mind. None of us really kind of grew up and wound up, taking the exact path that we thought we were going to take. Most of us took twists and turns. Life takes twists and turns. There's also this thing called the power of recovery. I don't know if I've talked about that in here. Have we talked about the power of recovery in here? Mm-hmm. So the power of recovery is a very interesting study that was done, and it was done by a sociologist. I can't think of his name, but basically he was trying to make the case that people who go through addiction are permanently disabled. And even if they get into recovery, they're still never going to reach their potential. So the best way to think of it is like this. I'm going to have to erase a little bit of this. Okay, so it goes like this. On this axis you have potential, and on this axis you have time. And based on a person's socioeconomic background, based on their education background, you can literally plot somebody's potential in terms of where they'll wind up with all the indicators of success, which you could argue aren't really indicators of success, but what type of job you have, how much money you make, quality of life indicators. And so you're able to plot that. So Rich had a certain trajectory based on my mom and dad, where I grew up, what school I went to. This is where I was going to wind up. Well, the theory went like this. Since I entered into addiction, I fell below my potential, and even when I entered into recovery, I would never be able to reach my potential because addiction permanently disabled me. And he was doing this because he was trying to make an argument for benefits for people who are addicted. Does that make sense? But here's what he found when he studied it. That we do fall way below our potential, but when we enter recovery, we actually exceed our potential. In terms of different kind of career goals, different things like that. And he called that the power of recovery. And I know for sure that that's my case. I was a marginal student whose main interest was partying, playing sports, that kind of thing. I wound up going back to school, getting 2 master's degrees. I wound up making more money than I ever made. Then I wound up actually caring about people. I would have just been, if I wouldn't have entered into addiction, I wouldn't have been a bad guy, but I'd have just sort of been a dude hanging out at Steeler games, getting drunk every once in a while, kind of hanging out. Yeah, okay, yeah, it's real cool, man. Now I have a purpose in life. Do you guys see that? Yes.
Did that apply to the whatever?
To the family members? To codependent?
No,
Co-occurring?
yeah.
Yes, I think it would. I think it would for sure, right?
Because my daughter doesn't think so.
She thinks it doesn't apply to her because she has a co-occurring issue?
No, she doesn't. We haven't talked about this, but she has a co-occurring issue, and she doesn't think she will ever be able to. I mean, she's smart.
So here's one of the things in general. We have to challenge people's thinking and the labels that we put on people and the way they start telling themselves, the things that they start telling themselves. Your daughter needs to get around people who are challenging her thinking in that area. Hopefully she can get around some people. We'll live into our labels, guys. If you tell us that we can't get there, then we won't get there. Yes, Cynthia.
Your bottom line is indicative of me, and I never had an addiction problem, but I had a son. But now
Absolutely.
Just come in here.
Because one of the things that happens, and this is huge, guys, is this making sense of suffering and developing a purpose in life that's beyond the purpose that we're given through the factory. And you know what I mean by the factory? The factory schools, the superficial badges and rewards that we get along the way. So I do this presentation that I'm doing, and I've changed my strategy around my presentation and my speech. What I do is I take pictures of myself from the past and I weave it into my story of addiction. So you have pictures of me when I was in middle school. You have pictures of me on the basketball team. You have pictures of me on the football team and all these other kind of things. And I talk about how my life unwound. It's actually pretty cool. I'll do it for y'all. And I was named the most versatile. Okay? I don't even what the hell does that mean? That means we like rich enough that we want to vote for something. We're going to make up a category. I don't know what that means. But my point being, all these badges that we get along the way and all these things that we this is the wonderful stuff. None of it is purposeful. You know, so I come out of this experience in addiction with a purpose, with a borderline obsession about trying to help and figure out this problem. That's much better than it would have been. By anybody's estimation, I'm a much better person. My wife says it this way: she knew me before addiction, she knew me in addiction, she knew me after, and this version of me is the best. And that's because we journey through that dark time. That's maybe one way to think about it. This idea of trying to make meaning out of suffering or dealing with that anticipatory grief. And what it is, however you do that and how you're going to do that is such an important thing to figure out on this journey, guys. Because this journey, it lasts a while. You know, there's some people in here that have been in here for a while. There's some people that have been coming to group for 3 or 4 years. You know, and if you've been through this, you know that it's not about getting your loved one in rehab one time. It's not about figuring out this issue one time. It tends to be a series of events, and it tends to be a long-term process. And how to make sense of that. That is a skill. That is something. And I don't know if anyone has suggestions for the group on how to make sense of it. One of the most common things is people lean on their faith. One of the most common ways that people make sense out of suffering is they lean on their faith. Okay? That's probably, if you did a survey, that would probably be the number one thing that came up. Does anybody else have any other suggestions? Carol?
What helped me through the darkest hours is the book by Viktor Frankl called
Man's Search for Meaning.
Man's Search for Meaning, yes.
Especially the first part. So it's 2 different parts. There's a book called Man's Search for Meaning by Viktor Frankl. And the second part is kind of like an exploration of logotherapy,
Right.
which may be something that you guys aren't really interested in. But the first part is about his experience in a concentration camp. The absolute worst of human experience. And how he got through that, and not only did he get through it, he actually thrived. And what he found was that the people who were able to get through there, they found a sense of purpose. They helped other prisoners. You know, they would think about what they were going to do to contribute to the world after they got out. He would actually do mental exercises where he would see himself presenting to a group on a different psychiatric kind of principle. He was a psychiatrist when he was in there. And that was the thing that he said carried him through. And so that's a really good example. What else related to making meaning out of suffering? Anybody have any other suggestions? Frank?
You know, coming through treatment and recovery, and you know, if you can say you're a success, then that's going to feed you.
So I got through it. Literally, I walked through the jungle, and I got to the other side. Very good. Related to that, if you have gotten to the other side or you feel like you're okay with it, one of the things people will talk about is they try to give back and they try to help other people. And that sometimes is a way, and you can help other people in all kinds of different ways. It doesn't have to be as a favor recovery coach. It can be you just give advice to your neighbors. It could be being here at this group as a way of helping other people, becoming involved. Just think if nobody came to this group, guys, and somebody walked in the door for the very first time. We need people who've been here for a while. So that's a way of giving back. Anybody have any additional examples or additional suggestions? And then the other thing is, give yourself a break. It's very normal to go through these things. It's very normal to feel like you want to shut down. It's very normal to feel like you want to step back. Try to avoid isolation at all costs. That's the one thing you're going to feel compelled to do, is to isolate yourself. And try to avoid isolation at all costs. So any questions about the grieving part of this process, or any comments about the grieving part? All right. What else are you dealing with? You're also dealing with a very, very natural response to a traumatic situation. That's the other thing that we got to... A lot of what you do when you're dealing with a loved one in active addiction is predictable. It's human nature. It makes all kind of sense. Your instinct is to protect the person. That's your instinct. That's not weird. It would actually be weird if you didn't think that way. You'd be like a cyborg or something. You'd be from the Matrix. You're going to feel compelled to jump in there. Your instinct is going to be to protect the dream and try to redirect the person and get the person back on track. And come on, we can do this. This isn't going to go down the way that this looks like it's going to go down. Here's the problem. Many times your instinct is not to protect yourself. Would you guys agree with that? If you had a list of folks on who's important in this situation, you're probably at the bottom of the list. And that's where it starts to get a bit problematic. Can we agree? It's that phrase, I fly a lot, and every time you're on a plane, what do they tell you? What do they tell you about your mask? Put your mask on first before you try to help anyone else. So this idea of trying to help yourself through this process, understanding that how a trigger works for a loved one in the neurobiology of trauma, and how let me go back here. If you see this, a symptom of post-traumatic stress disorder is repeated exposure to a life-threatening event for you or for a loved one. Now, I would make an argument dealing with active addiction fits into that category. Dealing with an active addiction, it's a life-threatening event over and over and over again. Almost every single day you probably feel like it could go down. So it's going to trigger trauma. And what's going to happen is, guys, deep inside your brain, you're going to be launched into this fight or flight zone based on different experiences that come down. Phone call in the middle of the night. A text message that wasn't returned. Somebody calling you up and saying, Mom, I can't pay the dealer. I've heard, now you guys know, everybody in this room knows, you put yourself in some bad spots, right? Man, people have met dealers, paid dealers, done stuff. People have gone out of their way to rescue people against their own better judgment. And if we were watching it on TV and I'd say that person's about to go to the hood, and you'd be like, don't do it. Don't do it. What happens? Why do you do it? Why do you act against your own better judgment? Your brain kicks into that fight or flight zone. It's almost the same thing whenever I would have a craving to get a hold of the substance. If you think about what happened to me when I was triggered and I wanted to use the substance, I would get triggered. That part of my brain, that instinctual part of my brain, literally like right here, would go into fight or flight. And for me, it became tunnel vision to go get the substance. And I was going to get it, and I was not thinking. My brain was not making rational decisions. I would make an argument. In a lot of cases, family members can go through the same type of thing, where it'll boom, and the next thing you know, you'll be putting yourself in a compromising position. Or the next thing you know, you'll be doing something that you said you weren't going to do again. I am never bailing you out of jail again. If this happens again, I'm not bailing you out. And then what happens? 3 days later, you get the call at 2 o'clock in the morning. Boom, you're on your way down there. You don't even have a devil on the shoulder, angel on the shoulder saying, don't do it, don't do it. None of that's going down. You're doing it. That kind of thing. And that's what's going on. Your brain, you're jumping into that spot. That's why you have to work in a therapeutic environment to get through that. That's why you have to relearn what's going on with you. You can change your response and set boundaries. You can do it. But you're going to have to interrupt that automatic process. Anybody have any comments on that automatic process or questions about what could be going on? Carol.
I had to add with one of my daughters that is not in recovery. I'm using pretty good boundaries with her, but I still have that fear that the next call I get from her, she's going to be dead.
Yeah.
So that's like a traumatic thing in my brain
Yeah.
So I really have to say to myself, put up a stop sign, stop, Carol. That
Yeah.
should not happen, you know. It's hard. It's trauma.
So, one of the theories on, why would your brain go to that? Why would your brain go to that worst case scenario type thinking? A theory would be that it's a way of preparing yourself for the worst possible outcome, and that by doing that, somehow that'll steel you for the actual event. And so if you feel yourself thinking that way, this is where classic reframing can come in. This is where classic recognition of the thought and challenge the rationality of that. Because just because you think about your daughter could die isn't going to make it any easier if she does die. Do you follow that? But that's literally what you're telling yourself, guys. You're literally telling yourself that if I'm prepared for this, and it's very classic and also in other areas of worry. Our brain is literally fooling us into, if I think about this, if I problem solve it, if I go there, that kind of thing. But if it works, do it. But it doesn't sound like it necessarily is a pleasant it's not a pleasant experience, right?
Yeah.
So you would want to recognize what you're doing and trying to step back from it. It's not going to prevent anything bad from happening. Worry does not prevent anything bad from happening. All it does is keep you up all night. And you don't sleep. Now, I wanted to say one of the things that happens whenever you're going through this, because we're running out of time, is this is what will happen as you go through these experiences and you repeatedly attach yourself to the person, and you repeatedly over-respond, and you become so enmeshed in your life, and this is the term codependency. How many people have heard the term codependency? It happens over time, right? It's just like a person who is addicted to substances. It's not like on Wednesday you weren't codependent and on Thursday you were codependent. It moves in over time. And this graphic is meant to kind of show how your life is dictated by the person's life. You literally start, if they're down, you're down. If they're up, you're up. If they're moving over here, you're moving over here. They move, you move. It's hard to tell where they end and you begin because you become, and now remember, it's happening over time and it's happening because of natural responses. It's happening, it's normal for this to go down because you're trying to respond to an abnormal situation the best you can. Now, there's a couple different ways to look at this. One idea is the bologna sandwich idea. And that is tear yourself apart from each other. You go to your neutral corner, you go to your neutral corner. The addicted person focuses on it. Oh, excuse me, I got these backwards. Look at this, I got it completely backwards. What do you mean I spelled it wrong? Isn't that how you spell it? Oh, you're talking about Bologna? I'm talking about baloney. I'm not talking about Bologna. I'm from Pittsburgh, Pennsylvania. It's baloney. And you guys can say whatever you want. But what I did do wrong is I have these backwards. This should be over here and this should be over here. Okay, I apologize for that. But basically, family members are told to focus on yourself, stand back, wait. The addicted individual will hit bottom and then they'll get better. You work on yourself, let them work on their self in a response to this. So can you see there is some logic to that, right? Because we know that this is not healthy. This is probably better than this. But is another way to go about it this. Okay? Where you pull yourself back from the situation, you try to get some healthy boundaries, but you're still involved. You're not on the other side of the ring. You're still in the fight, but you're just not quite as in the fight. And you're focusing on setting healthy boundaries, and then they're focusing on trying to initiate recovery. And I have in the who can help. And this is where hopefully the person's getting involved with other people. And we've talked about this last week, guys. This is where you're only going to be able to do so much. You're only going to be able to do so much in terms of actually supporting the person in the recovery process. Even if you're in recovery yourself, even if you're a professional working in this field, you're not going to be able to be the primary one who carries your loved one through the recovery process. So that's the part of the equation that you don't have a lot of control over. You don't have a lot of control over whether or not they call their sponsor. You don't have a lot of control on whether or not they show up for their therapy appointment. You might, depending on how old they are, you also may be able to do an intervention and get the person to, wind up going to rehab, but there's still that long-term recovery process, right? That they're going to have to manage. So does this make sense? This is more what we're going for. This particular graphic here. We don't want you to be caught up completely with the person, but we also don't recommend that you completely detach, and it's all about learning how to set boundaries. We've been talking about setting boundary the whole way through this, but guys, you could sum family recovery up into two things: learning how to set boundaries and learning how to deal with stress. Because the stress of dealing with this issue. But learning how to set boundaries, that's really what it's all about. So if you look at this, let me get you, we're going to go through this because we're running out of time. Hold on a second here. Where's the best? So boundaries do allow consequences to occur. I don't know why this thing is automatically running. I apologize. But boundaries involve setting limits and allowing consequences. This is what you did with jail. Do you guys get this? Yeah. Boundaries, even though we're not using the word tough love, there are still some principles that you could say come from tough love that are translated into setting boundaries. You got to allow the consequences to fall where they may. Now, well, I mean, unless the person is in danger, sometimes I'll step into situations, that kind of thing. But for the most part, allowing consequences, letting the person experience that. Boundaries are walls. Boundaries are not walls. They're fences with gates. Does that make sense? This thing is running. No. And I'm about to wrap this bad boy up because this thing is frustrating me. All right, I can't take this anymore. I'm going to turn this off and we're going to talk the rest of the time. All right. So... What is going on here?
He's getting better.
All right. So any questions or comments about anything we talked about tonight? Anything I can answer before we wrap it up for tonight, guys? Yes, ma'am.
I just wondered, over time, does their brain get better than it was?
Yes, great question. So this situation that I showed you early on gets a lot better. And it gets better relatively quickly. Once you stop using the substance, and there are some things that can help you move it along, things like exercise, going to meetings, getting a therapist, taking care of yourself in other ways, but absolutely this changes. People will say, how long does it take to change? I would say I was profoundly different at like 60, 90 days, that kind of thing. Almost immediately you start to feel better. But you can't beat your brain up, and you can't just continuously throw these heavy-duty chemicals into your body and not expect something's going to go down. Yes?
To go along with that, then what is your opinion of using some of the drugs against drugs, Suboxone?
So we think, that's a great question. There's different medications. There's Suboxone, methadone, and stuff like that. So our philosophy is as simple as it gets. We want you to come here. We believe you're in recovery. If you say you're in recovery, come on in. We'll help you figure it out as you're here. And what you need on day one may not be what you need to do on day 365. We also know that keeping a person alive is the most important part of this equation. And, so we would support that. Our approach is we don't really differentiate. We want to individualize it through our coaching services. And we've had a lot of different experiences with folks in that area. I will tell you that access to medication-assisted treatment in our area is very, very poor unless you have money or unless you have insurance. You really probably aren't even going to get on it. So it's a very, very difficult situation. For those of you who don't know, it's a medication to help people who are dealing with opioids. There's also medication to help people experience less cravings with alcohol. You hear this drug called acamprosate or naltrexone. You may have heard that, but primarily we're talking about opioids. What other questions or comments, guys? Frank?
I think that tough love, I don't know if it was meant this way, but I believe it's harder on the person
That's doing it.
that's doing it.
Yeah.
And I think that fits more than...
Yeah.
I mean, she had the perfect thing happen. and you don't really want to think about sending anybody to jail, you know.
Right.
That's a tough thing to.
There's nothing easy about any of it, guys. I mean, I want to tell you, I would go on the record, like, there's nothing easy about setting boundaries and not bailing somebody out of jail or all that stuff that you got to do related to this. It is hard. It is freaking hard, man. And so that's why I keep saying, give yourself a break. If you feel like you haven't done it perfectly to this point, give yourself a break. You know, keep coming to this meeting, keep talking to people. You'll figure it out. You were gonna ask something?
Yeah, I was going to ask that. I think one of the hardest things for me and my wife too is it's got to a point we first came to Favor a good while back, and everything was going really well. And some things happened, and our daughter moved out of the house into another house. And for a while, everything went fine, and I was happy with her finances, and trying to put some stability, I guess, back in her life as far as her living expenses and things like that, and it was going really well. And all of a sudden, it seemed like the communication just stopped dropping. And she would text me or, talk to me, call me on the phone or call us or keep in communication. And for the last month, there's some other things involved, jobs, but she's got a different job and things. But I would text her, and she wouldn't text back. We'd call, and things like that. So how do you know kind of when to like let up, or when to know? It's put me in a bad situation myself mentally.
Yeah.
Because you start thinking of the worst when you do talk to her, maybe in 3 or 4 days. It sounds like she's doing okay, but you still don't really...
Well, you got to remember, you're allowed to put yourself first. I don't know if you guys could hear the comment. He said it's driving him crazy. It's mentally beating him up. And so you're absolutely allowed to look at this situation and not say what is best for my daughter, but you're allowed to say what is best for me.
Well, I don't want to do it where I've always been the type that, kind of like you said, alpha. If it's going to get done, I'm going to do it.
Right.
And I don't want to push her
Well,
away, but I think she understands, in my mind, maybe that's something's going on, that's maybe why she don't want to text back.
Yeah, and I will also tell you guys this. Your family, your instincts are probably right. When you're sitting there and your Jedi senses are going off and you're saying something's bad is going on, it's because something bad is going on, So trust your instincts. But at the same time, you're allowed to set these boundaries and do what you need to do for yourself when it comes to handling this. And the last thing I'll say before I wrap it up is there's no right or wrong way to do it. There's no right or wrong answer to your question. So you try it. You see if this is working. If you need to back off, you see if that's working. You may have to do an intervention. An intervention, I mean that in a loose term. You may have to confront her, whatever it may take. But give yourself a break related to that stuff. All right, guys, we're going to have to wrap it up for tonight. Now, I do want to let you know about one thing tomorrow night. If you're interested, at Furman University at 6 o'clock, we have Sam Quiones. Sam Quiones wrote the book Dreamland. Dreamland is a New York Times bestseller about the opioid epidemic. Favor has sponsored him. He's coming into town, and he's doing a presentation at Furman at the Trone Center, which you'll see when you get on campus. And so we would encourage you to come out, check that out. We're hoping to have a good turnout. If you don't have anything going on, come see us tomorrow night. We'll be back here. We will not be here next week. Next week is Easter, right? Yep. So we will not be here Monday. The following Monday, we will be back, and we'll be doing a regular open share. All right. If we can get a moment of silence for those still suffering with this disease, for the family members brought into this no choice of their own, followed by the serenity prayer. God, grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. All right, guys. Thank you very much.
It's good to see you.
Hey, how are you?